computer. All right. So here's a couple of things I'll tell you, which might help you. And so today's session is a Q&A for your interview prep. I can help you out if you have any questions. I know a lot of people text and I'm unable to answer or I'm not answering in depth is because I have limitation when 10 people message me, or if I'm in the clinic or doing something else, it just gets difficult to answer in depth. But today, if you have any questions regarding interviews or Caapid, you can text, like you can unmute yourself, you can ask, and I can help you answer those or try to go in a little bit in depth so that people can learn from it too, and it's on recording because otherwise I have to keep repeating it. So that's the whole plan for this interview. What I'm going to do is right now I know Colorado, NYU, San Antonio have sent invite. Are there any other school that have sent invites that I'm not aware of?
Virginia is one of them.
Okay, Virginia, is there any other school? Okay, so I couple of people reach out to me for San Antonio. All right, and I made a video on this, and one of the key things I'll tell you about interview is here's something which is very important. I want all of you guys to understand this is very, very, very important. It will help you decrease a lot of stress when it comes to interviews. It will sometimes, in order to understand the teeth as dentists, you have to zoom out a little bit and see the whole mouth, see the occlusion, see the TMJ, the muscles, or the body, or the overall system. In the same way, when you look at dental schools in US, when you will see their interview, the way they conduct interviews, I can promise you 95% of the schools are doing the same thing. And it's not just dental schools, even postgrad residency for perio, for prost, even the people I've worked with for the medical residencies, they get the same interview question, which is very weird because when you, it's like the same template or the same kind of question list most of these people have, and they keep using in different schools because the US academic system is comparatively underneath uniform. So the best example I can tell you, if if you get to learn how to do a PFM crown, like you're really good at it, and I ask you, can you now do a gold crown? You'll say, yeah, it's a few millimeters of difference, but once you master the principle of PFM, you can do ceramic or you can do gold or any other as well, because the basic principle is comparatively the same. Now, recently, in the past 2 or 3 years, they have started doing Kira talent assessment. And Kira talent assessment is a way of telling schools that we don't have enough time or the manpower, so we are going to automate. So what they are doing overall in US or in the world, there is a trend of automating things so we don't have to use humans anymore. So what Kira talent assessment is, by the end of the day, they can call it MMI, they can call it Kira talent assessment, they can use some other words to it. But by the end of the day, what they are trying to do is set an automated recording system where you're being asked questions and you have to record yourself. Does that make sense to you guys what I'm saying? You're more than welcome to unmute and ask questions.
Yes, doctor.
So the reason I'm saying this because it should people get very worried. Like I get interview from San Antonio, I'm getting from NYU, I'm getting from Colorado. Oh my God, these are three different assignments I have to do. And what I tell them, actually, it's a very good thing you're getting them at the same time, because if you prepare for one, you should be prepared for 95% of the rest as well. Now you might say, what is the 5% difference? Let's talk about that part. And I'm going to try to go more in depth today and try to answer for you. So the 5% difference where it can happen, and I have people who just gave interviews with Colorado and I got their feedback too. And most of them, what I prepared, it was very similar for them because it's the same ongoing trend not just for Colorado, all the schools. So the 5% difference where they can play games or make it a little bit different to show we are special is, for example, they give you a radiographic interpretation. All right. Now, UCLA, when I gave interview, they will ask you the same personality related question, but they did the same. They showed me a radiograph or a case study and said, how will you deal with it? The same was done in Temple University. All right. But if you prepare for UCLA or you prepare for Temple University, it's very similar. The only question that might be different: why do you want to come to UCLA, or why 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 do you want to come to UCLA, or why should we pick you as a candidate? Kind of like that. But do you understand? Like, there's one major part of every interview, whether it's Kira, whether it's one-on-one for Colorado, for UCLA, for Tufts, for UPenn, they will ask you questions about your personality. They want to know you as a person. Now, if one of you guys, if I pick any one of you guys, uh, can I pick randomly? Are you guys comfortable? If you don't want to be pinpointed, you can just tell me no. But Dr. Mittal, if can you hear me? If I'm saying your name right, Mittal.
Yes, Doc.
Okay. For example, now if any school is preparing, asking you question, now you're a person. They read it. You're coming from most probably India, right? Now they want to, and you're a female, they know that you did your BDS, they saw your resume, right? For that, they want to know in depth what kind of a person you are. So their questions will revolve around a couple of different things. They will ask you, tell me about yourself. All right. They can ask you, tell me about a failure in your life. Tell me about a time when you had disappointment in your life. Tell me about a time, tell me about a strength in your personality or a weakness. So they can ask you, what's your long-term plan? What's your leadership? Tell us about leadership. Tell us about your legacy, like what kind of a person you want to be known when you die. How would your friend describe you in 3 words? Now, when you hear all of these different questions, all it's asking is about you. And to be honest, I personally feel to talk about a person that you have lived with for the past 30 years, it's comparatively very easy. Does that make sense what I'm saying, or I'm complicating thing? Because I might be, because I'm talking to myself.
I'm getting it, Doctor. Hello.
Okay. For the rest, do you guys have any questions? Is
Not
this
your part.
okay? So what I want you, the reason I'm doing this blah 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 is just to make you understand first that don't get hung up if there's 5 different interview calls you got. Don't get scared. By the end of the day, any interview will 90% of the time what they are trying to accomplish, they want to make sure 3 things about you. They want to see as a person what kind of a human you are. Can you they are trying to make sure that you're a good team player. You're somebody they are trying to make sure that you're a good team player. You can learn, like you can take feedback, and they want to make sure that you won't be an annoyance. Like you can follow rules, you can follow guidelines. That's why they ask you ethical scenarios. Okay, so this is just a basic. I wanted to give you a over like a zoom out version. Now when I look back at all the interviews, that they were very similar, like it's all the same thing. If you prepare for one, you prepare for 95% of all of them. Now the next question comes, that what the main thing, the first question they will ask you will be, tell me about yourself. All right, anybody right now, if you want to prepare for your dental school exam, dental school interview, make sure you prepare for your tell me about yourself. It's one of the key things that's going to make you stand out. So anybody want to volunteer, I can help them prepare. They tell me about themselves if they want to. Dr. Priyal.
Yes, Doc.
So were you going to ask a question or you're volunteering?
No, I'm volunteering.
Okay, all right. So imagine now you guys can actually use the template that I'm doing. You can use it, you can grab a paper and pen, and the kind of question I'm going to ask you, some of them might work for you, some of them might not, but you can use the same workflow for yourself to create your own tell me about yourself, and you don't have to pay anybody afterward to do that. All right. So Dr. Pial, here's a question for you. So I would like to ask you, like, now you have to decide what you're comfortable telling in this Zoom call and what not. That's up to you. But tell me about yourself, like, where are you coming from? What's your background? Whatever you're comfortable. Answer me.
Mm. So I was born and brought up in the state of Gujarat from India, and I did my bachelor's in dental surgery from one of the esteemed dental school, and then I wanted to expand my knowledge, so I decided to move to United States. But initially, I wanted to learn more about healthcare system in United States, more about insurances, how it works. So I decided to do masters in healthcare administration, and I got experience of private practice, like as a dental assistant and a front desk. And now I feel like I'm ready for the dental school. So that's a journey.
So, Doc, here's the thing. You did a master's in health administration, right?
Yeah.
So, imagine I did the same. So,
Mhm.
even though our years might be different a little bit from the postgrad time, but most of us who's sitting up here have done BDS, have done some kind of practice. Some people did masters, some people didn't, but then they did dental assisting. So it's comparatively, most of you guys will say we can say the same thing. Somebody's coming from Gujarat, somebody from Punjab, somebody from Middle East, somebody from Cuba. So it would be comparatively similar. But now you want to, here's the key thing which I want to tell everybody. You want to stand out in a way that makes you unique, right? You want to be different. So the main thing that will make you different is to talk a little bit about your personal and your early childhood as well. Does that make sense to you guys? Because that is where we would be different. You did BDS, I did BDS, you did a master's, I did a master's, you did dental assisting. Well, I didn't do that, but kind of like shadowing stuff I did. So it's very similar and generic for 90% of the people who is watching this, right? So now is the time I'm going to ask you some questions, whatever you're comfortable. So I would ask you, like, Doc, you grew up in Gujarat. What city was it?
Baroda.
Is it a big city?
Like you can say medium, metropolitan.
Okay. And what profession were your parents in?
Engineering.
Okay. And your father was an engineer and your mother was also in engineering, or she was a stay-home mom?
Homemaker.
Okay. And what kind of engineering was your father in?
It was electronics.
And I know you find it a little bit weird. I'm asking all of these questions, but I'll tell you why I'm doing it and share whatever you're comfortable. So do you have any other sibling? How many siblings do you have in the family?
Two, and they both are IT engineer. Like,
so how did you landed up? You're like the odd one out. How did you landed up in dentistry?
So growing up, I was more interested in biology and science rather than maths. Like I was kind of weak in maths, and uh, so whenever we used to go out, I felt that the doctors that were in my family, like distant family, they were given always more respected. Like
Okay.
people used to see them with more respect. So
Okay.
that was one of the
So
motivation.
here's a question, Doc. So are you the only daughter? Do you have like brothers or sisters too?
Brothers, because I'm the only daughter with
And
10
and in which middle order are you? Are you the middle, the youngest, the eldest?
eldest.
Oh, okay. All right. Makes sense. Okay. And when you were younger, like in your high school time, did you played any sports, any dance, any extracurricular activities, anything special during that age, except for studying?
So I had an opportunity to travel a lot of countries, like at very young age. Like I had been to And because of my father's traveling job, we always accompanied him. So I think
Mhm.
that was not like my colleagues, like my classmates had an opportunity to travel Europe and other
Oh,
countries at a age.
how many countries? Which part? Europe? Like what? Just quickly tell me which places, though.
Like I have been to Dubai, Singapore, Europe, like London, Switzerland, and
But sir,
Germany.
I ask you, was there any incident, any exposure, anything that you remember from that childhood visitation or traveling that you still remember? Like, for example, the first time I entered New York, my eyes got so big looking at like the billboards, the people, the diversity, the rush. It was like I came to Mars for me. To be, it might sound awkward to a lot of you, but the first time I saw New York, I was literally in awe, and I would never forget that. So, in your case, was there anything that you can mention from that time?
Uh, uh, I mean, the thing is, it was same like your kind of experience going to an Europe, like all people, like big billboards, like good transport system, and
Which place are you specific? Be a little bit specific. How old were you? Which place was it?
I was probably 16 years old, or
Mhm.
as kind of maybe 15, 16-year old, and my visit to Switzerland.
Oh, wow. Okay, it
Like,
must be really pretty.
yeah, at that time I had an opportunity to visit Alps mountain, and I have been to Italy, so Venice and all. So I was amazed with the beauty and all.
Okay,
And that's why it was one of the charm that, settling in a US and all will give
okay.
opportunity.
All right.
Be-
So here's a question. Uh, except for, okay, visitation was one thing, but back home, did you do any artwork, any dance, any sports, any other things as the eldest daughter? Were you involved in any other responsibilities or leisure activities?
Um,
Anything that you remember. Doesn't have to be exactly cooking, sewing, whatever.
Maybe Rangoli art I used to do.
What is that?
It's just made during Diwali, like it's a
Okay,
kind of.
okay. All right, got handy. Like, okay, I understand. All right, I know rest of the people are getting bored right now, but hang on. I'm gonna show you what I'm doing, and you have to do the same thing to yourself. Okay. All right. So after that, you got accepted to the dentist school, right? Was your dentist school in the same city? Was it in a different city?
Different city.
Okay. And did when you moved out of your house, which city was it?
Baroda.
No.
Okay, it was Ahmedabad.
Ahmedabad. Okay, so you moved to a different city. How was the transition for you? Because you grew up in a house, you're kind of like the only daughter, kind of in a way protected, but now you're going to a different land, like different city, different environment, being yourself. How was the early transition for you?
Honestly, it was difficult doing everything by yourself because earlier parents used to provide everything ready, and now you are managing everything by yourself. So it
Mhm.
was tough.
Okay, so what things, if I ask you, helped you to overcome that difficulty?
I think being organized, making list of things,
Okay,
helped me of tasks need to be done, and
okay,
managing to-do
okay.
list helped.
So the next question, Doc, is during your dentist school, everybody who's watching this did a dentist school, did BDS, a didactic part and the clinical. Was there anything different in your life in during dentist school that you would like to highlight? It could be a community work, a dental camp, a distinction, an award, anything that you would point out.
I think going out in remote areas kind of
Mhm.
was a rewarding experience, because at that time you are actually like trying to clear so much myths about dentistry.
Can
Uh,
you tell me any specific, and for the rest of the you guys, do see that I'm asking something. Anybody can say I went to a community work, but can you tell me any specific experience or exposure during those dental camp that you still remember? Any
I'm
incident?
Yeah, I met like an elderly person who was
Mhm.
like relying on home remedies, and then because of lack of access to care, and they were
Mhm.
not going,
Mhm.
and they were relying on home remedies. But
Mhm.
after our visit and some basic treatment, education, and asking him to come to a dental school for treatment,
Mhm.
he came, and kind of we did like a treatment for him. So that was a like he used to come from area where they were already relying on quacks or home remedies, but now he actually came to a
Okay.
provider.
Okay.
That was
Anything else from your dental school, doc, that you would like to point out?
mm, it was just basic clinical dietetics.
Okay.
And
Did you any exposure to any international conference, anything like that?
uh, we used to have some good CE courses like composite hands-on courses, because typically dental school have amalgams and every
Okay.
that.
Okay. And anything, okay, after your graduation, you worked as an associate dentist for how long? I'm going to be a little bit quick because these other people would run out of patience. So, any other experience?
1 year. 1 year.
Okay. Anything specifically you did or learned during that 1 year that really stood out?
Uh, I think it's just more so improving on hand skills.
Okay.
Like initially, you're not confident; it takes
Okay.
more time. But then
And
with
what year
practice,
did you graduated or move to US after that? What year?
2018.
And when you came here, you did a master's in health administration, right, doc? When you came,
Yes. Hello.
yes, did you did a master's in health administration?
Yes. Yes.
And then you worked as a dental assistant for how many years?
Initially worked as a front desk billing coordinator, and then for 2 years have been working as dental
Good.
assistant.
And where do you work as a general dentistry practice?
Yeah, general dentistry
Okay. Any
practice.
volunteer work?
Volunteer with Mission of Mercy,
Which Texas? Which place?
Texas.
Okay. And after that, any other extracurricular activities that you still do or you're involved in?
Food bank, uh,
Which place?
Houston.
Okay, all right, good. I'm sorry I'm not able to go into more detail, but now's the magic time, okay? You pronounce your full name Priyal. How do you pronounce it, doc?
Priya Thakkar.
Tucker. Okay, all right. So I'm gonna be you. All right. That's what I do when I do one-on-one session with people. I know a lot of people are getting annoyed. What is Adriel doing and all of that, but now you will understand what I'm doing. Okay. So, doc, Dr. Mandeep, I'm putting you on mute. Okay. All right. All right. Dr. Priyal, I'm gonna be you now. All right. Tell me about yourself.
Can you tell me about yourself?
Thank you for giving me this opportunity. My name is Priyal Thakkar. I was born and raised in one of the metropolitan cities in the center of India, in the state of Gujarat. And I was fortunate that our city had its own diversity. But my father, who was in engineering, worked in a multinational company where he got the opportunity to interact with a lot of multinational companies and had to travel. And he was very, I would say, he was very much dedicated to get his children exposure, education, and wanted to broaden our horizon early on. And that was one of the reason at the age of 16, I got to travel 5 different countries. I got to go to Europe, in Italy, in UK, in the Middle East. And one of the reasons he did that, he wanted us to see more, he wanted us to expose to the education and the innovation that was going on in other countries outside of India. And I think that really shaped or gave me a spark in life that there is something beyond my comfort zone in life. And when it came to picking a profession for me, my family mostly has engineers, but as a eldest daughter, I always felt like I wanted to do wherever my personal calling was. And I felt I always wanted to work with people's pain. I wanted to work with human beings. And that's why I felt like dentistry would be a very good opportunity to work with my hands and relieve people's pain. And my hard work paid off, and I got accepted to a really good dentist school in another part of India. So at the age of 18, I had to move out to a different state, live by myself. And this was a big learning curve because now I was away from my family, managing my own schedule, making my own meals, and learning new languages and diversity inside of India. And I think one of the key things that helped me during that time was getting myself more organized, making friends that were constructive, and that helped me excel in my academics as well. And during that time, I got to be involved in community health, see how underprivileged communities inside in India are suffering due to low socioeconomic status. And after my graduation, I worked for 1 year as a GP, where I got to learn to do restorative pros. But I personally took part in conferences and study clubs, which exposed me to new innovation in outside of India. And I learned that one of the best education right now is in the United States. And I think that really helped me and ignited a spark that I got accepted to a master's in health administration program in Texas, where over the past 2 years, not only did I get to learn about the dental insurances, about the academic system, about technology, but I got to learn the professionalism in US. I got to learn how to interact with my peers and with my faculty. Beside this, I've been working 2 years as a dental assistant, and time to time, I help my front desk dealing with insurance systems, scheduling patients, and doing other technology related tasks as well. Beside this, I volunteered with Mission of Mercy in Texas, which is a great opportunity for me to learn about other people's need, learn about the opioid crisis that is going on in US. And beside this, I like to read books and travel whenever I get the opportunity. So uh, I know this was a little bit longer, but now imagine you took this recording, you write down, and you take out whatever you want to, and you add what you want to add. All right. Now, when you say this kind of tell me about yourself, you are a much more interesting person as compared to what you said earlier. Does that make sense, Dr. Priyal?
Yes, yes, doc. This makes interesting and a different story.
And I know the other people who are listening, some might be getting confused, some might be want to have this, but I just want you can use this what I did in your own self too. All right, you don't there when I do one-on-one session, that's the number one thing I do. I spend so it's a 2 hour session. I end up spending 45 minutes listening to them, and then I actually become them for a few minutes. I think if I was them, how would I tell my story? All right. And now, if they ask you, for example, if they ask you like a strength, you can always say that I'm a lifelong learner, right? Because you did your BDS, you did a master's, you're doing dental assisting. That shows that you're somebody who's consistently trying to learn. Now, some people who traveled or lived in different part of the worlds or different, I had somebody who lived in Middle East, then in India, then in US. In their sense, it's more about flexibility, being resilience or adaptability. So when I listen to their stories, I can gather like, okay, this person has a lot of adaptability, or this person is a lifelong learner. Some people had to deal with sickness of their husband or their family or their parents or a kid that taught them to be patient in life. So you have to find, like when you write down your story, you'll start to see this is my strength or this is my weakness. Is this making sense to rest of the people? I know some people messaged me, they wanted to ask me a question, but does this make sense to you guys? Guys, are you there?
Yes, doctor, it makes
Yeah,
sense.
doc, it perfectly does.
Okay. And you can actually, if you listen this, you can break down the process for yourself, and you can, it might be a little bit different, but you can replicate this. The thing is, everything is it's you might ask, how did I come up with this? Well, I listen to a lot of psychologists. All right. And this is not a therapy session, this is an interview prep session. But when I listen to people, it's kind of like I listen how therapists listen to people's, psychologists listen to people's story to understand them. And I think then from there you can pick the things that are the strongest in your life. Imagine if you are writing a book on yourself, and I ask you what will be the contents, like the chapter names. So you pick out the main big things out of your life that really created an impact. All right. So for any interview prep, guys, any interview prep, I'm giving you a cheat code. If you can create a good tell me about yourself, 70 to 80% of your interview is done. Like you nailed it. Why? Now imagine if you say or tell me about yourself like close to this to the faculty, or even if you're prepared, your confidence level is going to be way high. That's the key thing. One of the things I've learned like there was a kind of like a psychology thing I read. They said people, even if they are prepared for an interview, even though the question might be different, but because they are prepared, their stress level are low and they do much better in interviews. So even though they might ask you, so in interviews like recently somebody gave me a feedback, they did not ask them tell me about yourself. They started with tell me about a failure or tell me about a weakness. But because you were prepared, you're much more relaxed and your brain can create answers. One thing I'll tell you, one of the biggest enemy of interviews is your own stress. It's your own stress. Well, it's the enemy of everything, but it's the biggest stress I can tell you. I've known people who are so good, who are like, who can talk very well, but in their head, they are thinking about all the reasons they can fail. And if they fail, their auntie in the town will laugh at them and they will feel bad, and then they go in a negative loop. And when they sit in the interview, they are just in a state of negativity. Like, so number one thing, I've talked to somebody who dealt with some past difficult situations. A lot of people, like I know females who went through miscarriages or maternity issues or divorces or some kind of abuse, which is sad. We as men do it too. We hold trauma. And what the trauma does, one of the things, it never lets you think positive of yourself. I've fought this myself. I've learned this. Well, I can imagine I can be a very successful guy, but the reason I'm not able to imagine it is because my freaking trauma will stop me from. And one of the things you want to do before you go into an interview, before you go in Akira, sit down by yourself and imagine if you were like at a level where Shah Rukh Khan or Tom Cruise or any big person would be, what will be your confidence level? Like give yourself, just imagine how would you be confident if you were at that level? Because if you have that energy, if you have that confidence, there's a psychological like study they did. People who think they are lucky, they actually end up being lucky. And there is a scientific reason, because when you think you're lucky, you will create solution. That's a growth mindset. Whenever you have a problem, you say I'm a lucky person, and what happens, your brain is in a positive state. You'll find solutions to come out of that problem. But if you say no, I'm always a victim, bad things happen, I fail, just like how my family members tell me, then you will end up creating more and more and more problems. And God forbid you start having negative suicidal thoughts. So you want to destroy that loop as early as possible. And why I'm saying this, because I've dealt with a lot of negative thoughts throughout my life, and you have to overcome them. That's what makes you a different human being. And so, not to go into this discussion more, but does this thing make sense to you guys? And if you have questions regarding this, you can ask me. Okay.
Hello,
What?
Dr. Adriel.
Mhm. Go ahead.
Okay. Hi, Dr. Adriel. I have a question. So, one thing I want to know from you, and only you can confirm if it's a rumor or true. So, a lot of the time, people say, do not say anything negative about yourself in an interview. Let's say, for
Do not say
example,
anything. What? Sorry.
do not say anything negative about yourself in the interview.
Okay. Good.
Yeah,
Very good
like,
question. Thank you. What's your name, Doc? I can't see you on the screen. That's why.
my name is Tammy.
Sorry, your name is Tammy. Okay. Yes. Very good question. Thank you for asking that. Now, here's a very okay. Imagine I'm going to tell you an honest thing right now. A lot of people who reach out to me for like assistance or help or whatever coaching, they say, well, the reason, doc, we are willing to pay you money is because we feel we can connect to you. What you're saying seems real. It seems real what you're saying. And I thought about it when people said it. The reason is because at times I'm willing to share certain weakness out of my life because I know as a dentist, as an immigrant, as going through this process, we can connect. So what I tell people, you want in your interviews, in your interactions, you can show vulnerability. Now, understand the word when you said don't say negativity. I'm saying you can show your vulnerability as long as you mention that I am working on it to improve myself. Now, you need to understand I was initially being trained by surgeons. And surgeons, there's one rule. Even if you're wrong, never accept it. Like you're not supposed to give any sign of weakness. Sorry if there's any surgeon in the room, but that's how surgery works. That's the culture, that's the mindset. Like an army person, if somebody dies cause of you, it's fine, it happens, I didn't do it, right? That's what they are taught. But and most people try to do that in interviews, but in US, when they are looking for a student, their biggest concern is this person was a dentist back home, practice for a couple of years. When they will come in the school, can they take feedback? Can they take uh, criticism? Because if you can't take feedback and criticism, you you're not a good student. You're a stubborn ass. You're a jerk. Because that's why they don't like surgeons in the school, because it's very hard to retrain them because they are very stubborn people. And that's how they are. They do the things that very less people are capable of doing, but there's a price to it. So they ask you in the interview, tell me about a failure, tell me about a weakness, tell me about criticism. These are questions to see if you are self-aware and can you talk about your vulnerability. I have learned from people like Obama that you can actually connect to people if you can show your vulnerability in a little bit calculated way. Now, when I'm on social media, I have to be careful. I don't want to say something so far off stupid that you'll say, okay, this guy is a creepo, right? This is too weird for me. But I also want to show my human side. And same in the interview, I'll talk to them. Okay, for example, if they ask you about a weakness, I tell people always start off by saying, one of the things I've observed from my past is that I have ability to overthink. That's a negative thing, right? But I've learned from mentors, from reading books, from doing yoga, that you have to keep yourself organized. And one of the things you do is you try to create a purity list. You create a checklist every day for tomorrow, and you try to prioritize yourself and don't let your thoughts run loose. And that's one of the things I've learned, not to overwhelm myself. And I try to go to sauna or do yoga or do exercise to keep my brain fresh and get more oxygen. Now, I just said something very negative about it, but when you're hearing it, you're listening to it in a positive way. Yes, I fell down. I learned that I have mistake as a human being, but I'm a recovering person. I'm trying to get over it. Does that make sense, Dr. Tammy, what I just said?
Yeah, it does.
So now they will ask you about a failure in the interviews, which every school love to do. They will ask you in the Kira talent assessment about failures. Always say, yes, there was a time when I failed in my biochemistry exam, in my TOEFL, in my school, in my sports. You mention that, all right? You talk about that failure, but talk about it for like 5 seconds, like 5%, and then the rest of the 95, talk about how you overcame it and how it makes you a better human being. Does that make sense?
Yeah, it does. Thank you,
Okay.
doctor.
Sure. All right. Any other question, guys?
Hi, Doc.
Yes.
Yes, Doc, I have a question about, is it okay to give a prolonged answers like about introduce yourself or tell something negative or positive about yourself? Is it okay to give prolonged answers in detail?
Okay. Here's my answer. It depends. Now, if you're in a Kira, you don't have time. And remember, in Kira, you don't know who's going to be listening to this. If I'm talking to a female, if I'm talking to a male, if I'm talking to a Chinese, an Indian, an American, certain things, certain cultures can understand, right? Now, if you talk about India or other third world countries, Pakistan, where there is more uh, joint family system, right? Now, people can understand, Americans won't understand. So, if you're preparing for Kira, I tell people keep it very simple, keep it straightforward, and remember it should be in a manner that even a non clinical layman person should be able to understand. Does that make sense? Now, if you're in a one-on-one conversation, how long should an answer be? I tell people interviews is like a ping pong game. It's a tennis game. The ball has to go to the other side of the court, otherwise you're not playing. So it should be long enough to the point that you're conveying your message, but you're not holding the ball to yourself. You want to keep them interested, you want to keep them entertained. If I right now when I'm speaking, I'm asking you guys, tell me a question, because I'm behind, I'm thinking, am I boring the hell out of them, or am I just speaking to myself? Like, do I can't see your faces, but if I can gauge from there if you're interested or not. So when you're in your one-on-one interview, be a little bit cognizant that look at the other person if they are getting bored and you're speaking too much. Just because you're given a chance to speak about your own self doesn't mean you need to bore the other person. The other thing is, when you're speaking in an interview, like, just make sure you look at the other person, and keep it in a way that's engaging. You want to say something and let the other person ask you more questions about it. That's a good conversation. Like if I'm talking to you and say, oh, I came in 2016 to do my master, you'll say, oh, what kind of master was it? See, now you're asking me leading question that shows that I'm keeping you interested in the conversation. So you can say it long enough to the point where you're keeping the other person interested in the conversation and you're conveying your message. Don't make it a therapy session. I know there are a lot of females I can understand who went through. We, as immigrants, we are coming from cultures where women are not given enough leverage or liberty to do. There are domestic issues, there's generational traumas. I can understand, but in a professional setting, don't let your personal trauma enter. You want to tell things, but don't make it a sob story. Don't make it a therapy session. Keep your therapy session separate with your friends, with your family, with your therapist. And interviews does touch upon your personal life, but they have to remain professional. So find a good zone. And to the men out there, sometimes they want to act like they are the Hulk. They have done everything and they are right and they are very strong. You want to show your vulnerable side too. That's called, in psychology, there's a word called, like, in Carl Jung was a psychologist who said a well-rounded individual is somebody who's in touch with their masculine and their feminine side. As a male, I should be able to understand my masculine and my feminine side. That is what makes me a well-rounded person. The same goes for the ladies out there. It's called the anima and animus, but the point is, this is where you learn to be well balanced. So you don't want to act too much about the negative part, and you don't want to look like you're a very strong person and you don't give a crap and you get the job done, because both extremes are abnormal. You want to find a safe zone in between. Does that make sense, guys?
Yes, doc. Thank you so much.
Okay, one other thing I'll tell you guys, very important, is to keep a headshot picture on your Zoom which is professional. I see Dr. Shruti has one, which is good, and she's smiling in there. Few other people have it, Dr. Sandeep, but for the rest of all you guys, Dr. Aarti, if you're listening, I'm pointing you out. Don't put your Instagram or Facebook or WhatsApp picture. Take professional headshots that are on LinkedIn and put it on your Zoom. That's very important. Dr. Noor, if I don't know what you have on the Zoom, but the reason I'm saying this, because at professional level, when you have that kind of picture, they can see this person is a professional who knows how to use Zoom. Does that make sense, guys?
Yes, doc.
Yes, doc.
Okay, so this is a very small tip, but it just helps you in the professional world a lot. Now, one thing I was thinking that I want to talk to you guys is about setting up your cameras. When I do interviews, I see people who would place cameras at a little bit sorry, let me. All right, who place cameras too far away. I want to show you a screen share. I want to show you a picture that I was researching on yesterday. This is from a so some of the things that you hear from me, I learned it from psychology people, from body language people, people who kind of, I was interested years ago in these kind of things, and now I just correlate them in interviews. So Megan, this is, can you guys see a picture of this person and this diagram? Are you guys able to see this?
Yes.
Yes, doctor.
Okay, all right. So understand what this picture is. And this is important for you as a doctor, as an assistant. Remember that as human beings, if you're in a Walmart and you ask somebody, where is the shampoo or where is the soap or where is the beans, you talk to them at a 9 feet as a human being, and especially females, they want to keep this on average 9 feet of distance from any stranger or any person they just met. Because as human beings, our brain is actually much more comfortable with this gap. Now, when we are talking to somebody at a little bit more professional or personal level, we keep a 4 feet of distance. All right. Now, with your family, with your kids, with your spouse, with your loved ones, you can get to really close, which is the intimate space. Now, the reason I wanted to show you this diagram, because when I'm placing my camera, I keep a distance of 1 arm length, which is approximately 4 feet. If I go 9 feet away, you will feel like I'm very distant, and your brain will see this image as a different thing. So when you're placing your cameras, just imagine from the tip of your nose, if you can keep 1 arm's length away, that is a good distance. Now, if you look at FaceTime, or like I was listening to this video on Apple, like the way they created, if you open up the FaceTime, it just puts the other person on your face. It's very close, it's very intimate space, and you can get annoyed if you don't know that person. So one of the key thing is, when you place your camera, keep it at an eye level. All right, make sure you're sitting straight with your shoulders towards the person, because somebody gave me a feedback from UMNN from Indiana. They talked to the program director for Kira, and they said, by the end of the day, we aren't even listening to what you're saying. We are looking at how you're saying it. So we are judging you by your confidence, by your eye contact, by your presentation, by your body language. This is how much important is your presentation. Is this making sense what I'm saying, guys?
Yes.
Yes.
So
Yes, doctor.
even
Yes.
before your interview start, your presentation of the room, what you're dressing, your light, your camera matters a lot. Trust me, guys, you might be the most prettiest human being walking on earth, but if I put bad lighting on your face, it will make your skin and your face look weird. And on the other hand, if you're not such a good looking person, you can use tricks like me where I have very good lighting. Well, obviously now I do it as a business, so I can, but even you can take very normal lamps and just put good lighting. It will make you look more positive, because now people can see you in light. Now you might be saying, Adriel, you're teaching us YouTube. Let me tell you one thing, whether it's YouTube, Instagram, interview, human brains work the same way. We all have a bias. There's a reason we follow beautiful people on Instagram. There is a reason beautiful people or good looking people get more acceptance. It's just a very silly thing. I don't like it, but it is the truth. This is backed by science. So now you might say, I'm not the prettiest looking person. Well, my father used to tell me, this is a very politically incorrect thing. I'm going to say something in Urdu. He was a professor. So he used to tell me, like, agar khuda ne shakal nahi achhi di na, to kapde achhe pehen lo. So if you're not a good looking person, at least dress up well. That's what he used to tell us every day, because he used to teach and he used to get annoyed that people like kids would dress up weird in college or university. So again, your presentation matters because when you turn on your camera, their brain makes a decision or a perception about you in the first like 5 seconds. As soon as I turn on this camera, like your guys, your brain creates a judgment. That's how human beings work. And once you know it, you learn to use it to your advantage. And this is already on internet, on YouTube, but because we are dentists, we never care about it. Because when I was giving interview, I saw people with clothes hanging in the back. And I tell people, don't use plain walls in the back. Put some painting. Like the other day, it was so nice. I never seen this. This was a Pakistani guy. I was preparing him, and his kids had make like letters, like with hearts and flowers, and he had it in a back. And I never thought of it, but it looked very sweet. It showed a very like family-oriented, loving side of his life, which is nice. I keep books. I don't put stuff like that, but people have guitar somewhere or painting or something that adds color. Like, remember, I put this pocket square because even though I'm looking like a professional wearing everything, but it adds a color to my personality. In the same way, the way you dress up, the way you present, the way you decorate your room, you can add very small thing that adds a artistic side or a color. Now, don't overdo it. I'm not saying to do, but find that fine line because presentations will make a lot of difference. Trust me on that. In Kira, because in Kira, you don't know who the next person is who's watching this. And imagine if you have to go through 200, 300 of videos, and all of a sudden one person has an interesting or a better visual, a better camera, and a better lighting, and is pleasing to the eyes, you'll say, thank God I got to see some pretty face. We pay to see beauty. That's why we pay in cinemas to watch movies, right? That's how human brain work. So use it to your advantage. All right. Now, one other thing that I wanted to share, and I was watching this on yesterday, and I thought this was important, is that if I would speak like this for like 1 hour to you, and I'm not giving any facial expressions, and I'm not showing my hands, your brain after the 5 minutes and 7 minutes might think, where is his hands? What's going on up? Like, it's not that you are weird. It's just your brain is like, where is this person's hand? Think about it. The reason is because back when early caveman time, if we can't see a person's hand, they can stab us, they can hold a weapon, they can be a threat. So as a survival, what humans did, anyone who shows palm is safe. That's why please say, show me your hand. That's why on video, when you see somebody's palm, Trump uses it. I know the Pakistani Prime Minister Imran Khan used it. A lot of people did. Was when they show their palms, it creates a sign of interest. Now, the reason it shows a sign of trust. The reason I'm telling you this guy, because telling you this thing, because 90% of people I interview will never use their body language or their hands. And like you're missing out on a very key thing that can make people think of you as more trustworthy and more more, they can connect with you. Remember, interviews, I tell people, when it comes to bench exam, it's all mathematical. You pass, you fail. When you come to interview, it's all emotional. There is a human bias. If you like somebody, you'll say, it's fine if they don't know the answer, but they were a very nice human being. But on the other hand, if you don't like the person and they have a lot of knowledge, you'll say that was an arrogant jerk. Because that's how our human emotions work. We end up liking people and creating biases towards them. So when you understand this, you learn to use it to your advantage. Now, somebody might be saying, oh, he's trying to teach us sneaky stuff. Well, to be honest, as a dentist, as a provider, as a clinician, that's what happens every day. Patients come to you not because you know the best restoration. Patients come to you because they like you. That's how dentistry works. That's how any medical field works. Yes, you have to be competent, you have to work hard, but there's always human bias. All right. So going back to it, one thing I'll say, use a little bit of your hand gesture, showing your hands in between the conversation, using your hands creates trust. I listened to this person called Vanessa Van Edward. If you guys want to Google her or later on watch her video, very interesting. Back in the days I used to watch, and she other day she was saying like you can't lie. You can lie. Liars can lie with their words, but it's very hard to lie with your hands and gestures. If I have to say five and point out three, my brain doesn't find it comfortable. When I say five, I will do five, right? So it's kind of like our body, when we are saying the truth, our body will easily work with us. So when people are speaking with body language, we like those people because they are giving verbal cues and physical cues. I'm concentrating on all of this because not only will this help you in Kira, not only will this help you in the interview prep, it will help you later on with your patients at your job. I get things done because I'm not the smartest, not the fittest, not the tallest, not the biggest one in the room, is because I understand these things. And when I connect to people, it allows me to build better relationship. Most of my life, that's how things get done for me. So I want you to utilize these things. Does this make sense? I'm sorry, I went into a little bit more depth than I should have.
Yes, doctor.
Okay. Rather than me speaking more, I want you to guys ask me what interview questions you have, and then I can answer them accordingly. Go ahead, Doc. I know you raised your hand, Dr. Laura. Laura, am I saying it?
Yeah. Hello, doctor.
Hi.
I have a question about the interview. So I want to know how could I approach in a positive way my lack of experience in the US.
So
Like,
what? Wait. Okay, you're gonna ask me very quickly. I'm gonna ask you some quick questions. Quickly answer me.
Okay.
When did you graduated and where?
2020 in Ecuador.
Okay, and then what did you do after that?
Worked 1 year as a general dentist in Ecuador. 2 years I did my master's in oral surgery in Spain.
Wow.
Worked 1 year in Spain as a dental assistant and hygienist because I didn't have my license there. And now I'm working as a specialist in a hospital in a rural area in Ecuador.
Okay, and then you came to US, and when did you came to US?
No, I'm not in the US. I'm applying from Ecuador. I'm working as a specialist in the hospital right now.
Oh, wow. Okay, yeah, it's fine. There are people who
Never
get...
met any case where someone gets accepted directly from their home
No,
country.
no. Let me answer this for you now. I had class fellows in my University of Colorado who never worked in India, US, who were specialists back home or dentists back home. People do get accepted. So you don't need to be worried about it. Yeah, you don't have US experience, but you have Spain experience. So what I teach people, no, you can't lie. You can't say, oh, I did come to US and I was doing dental assisting, but I can't tell you. They're like, what the hell is going on? Is she lying? What's going on? So what you have to learn, this is for everybody. Like, guys, everybody has a weakness in their application. I'm standing in front of you. I did not had any dental assisting experience when I went to the interviews. I did some shadowing. And when funny thing is, guys, I went into Colorado's interview and their Zoom did not show that I have entered. And the faculty was saying, this person hasn't done any clinical work. He hasn't picked a handpiece since 5 years. Because I was doing oral surgery. I didn't pick a handpiece in my 5 years. And I was like, hello, I'm in the room. You're talking about me. And they didn't knew. And I knew there was a problem. They knew there was a problem. So now my brain is, you got a problem, buddy. Figure out how to overcome it. Number one thing I'm going to tell everybody, you might have bad TOEFL, you might have gap, you might have less assisting experience, whatever it is, there is always a way around it. Number one thing I'll tell you, the most successful people I've read books on, I've heard of, it's not that they are lucky all the time. Their brain works like, okay, we got a problem, let's use it to our advantage. That's the mindset you want to have. All right. So now, Doc, good example where you said about this. So if I would have to answer, I would say, well, that if, first of all, from your start where you say, tell me about yourself, I tell people it's better to address the white elephant in the room. Say it yourself. Like, I've been fortunate that I grew up in Ecuador, I did my BDS, but after that, I got the opportunity to go to Spain and be trained in oral surgery under very well renowned oral surgeons of Europe. And I got to interact with clinicians from US. And personally, I did not get opportunity to come to US and work up there, but being in Europe and working with American clinicians or assisting them in Spain allowed me to see a lot of exposure of how dentistry is being done in US. And personally, after that, I've been taking conferences. I've tried to interact. I've taken C courses, read journals, and I've tried to understand the American dentistry and the healthcare system as much as I can. And right now, my plan, if they ask you long-term plan, you can mention, I think getting good exposure from Europe has helped me. But if given the opportunity, I would like to learn dentistry, general dentistry, and I would like to learn the American system of professionalism and of the healthcare system as I move forward in my life. Because remember, they are not hiring you to be a faculty. You're not coming here to teach, you're coming here to learn. And if you say I'm the one person who wants to learn, they will like you. All right. That's the main thing. You want to address the weakness and say how you've been working to improve it, and you will continue to work hard if you're given the opportunity. So it's not about knowing everything. It's about the attitude or the aptitude you have towards things. Does that make sense?
Yeah. Yeah, that helped a lot, doctor. Thank you very much.
So this is the thing that I did when I in UCLA. Okay, I'm throwing a weird thing at you guys. At UCLA, I was being interviewed by two Asian doctors. One of them, when he got to know that I do a YouTube, I kind of work with refugees, immigrants, he was very much interested. And the other guy, Asian faculty, he was like dead serious. Like, he didn't give a crap about my extracurricular activities. And what he was doing, as soon as he finished up, he was like, okay, this is an X-ray. How will you treat it? Oh, I was like, all of a sudden, like, we are having fun conversation, and he pulled me into dentistry. Like, let's talk about serious stuff, buddy. And that's how most Asian people are. They are very work ethic oriented. And he showed me an interior teeth, and it had a root canal and a post, and it was broken. And he said, why did it broke? As a surgery person, I said the person got into trauma or playing football or contact sports. That's how surgery mindset works. And he like, he laughed and he said, no. Why did it broke? I'm like, I don't know, like trauma. Like, it broke because it had a root canal and a post. I'm like, duh. But I was not giving him the answers that he was looking for as a restorative doctor. Do you get what I mean? And US dentistry is very much restorative and pros based. All right. And I understood, dude, you screwed it up. You didn't say what they were looking for. And they said, I gave the answers, whatever they needed, to the best I can. And at the end, they said, well, do you have a question for us? And I said, well, here's a question. In the past, did you had any foreign trained dentists coming from a background of surgery who wasn't very good in restorative? Were they able to get accepted and learn in your program? Were you able to teach those guys? And they said, yeah, we had people and we teach them. They eventually learn. I'm like, thank you. That makes me feel positive about myself. And then I got accepted. Well, it's not always the point is, maybe I don't know what worked in the back and why I got accepted. It was God's will. But what I'm trying to tell you is that you're going to have some weakness. Your job is to not lie about it on number one, and then show a very positive aptitude about learning. That's how you overcome it. Does that make sense, guys?
Yes, doc.
Yeah. Dr. Sahil, you had a question, doc.
Hello, doc. How are you doing? I had a question that, as a recent graduate, as a fresh graduate, is it possible to get into a dental school with a very limited experience in the US and even back there in my country?
Yeah, I had class fellows and juniors in Colorado, and somebody I worked with, fresh grads who got accepted every year because they are looking for diversity. Imagine, I'm not young anymore. At least that's what I tell myself, because then I behave better when I tell myself I'm not young anymore. But the point is, uh, you when you're young, you don't have experience, but you know what you have? A lot of energy. If you have the right attitude, and number one, if you don't have experience, score good in your exams. You need to have good TOEFL. You need to stand out. Because you can't buy experience. Experience comes with time. Now you can't spend 2 years now getting experience. So what you can do is get really, really good scores in your exams and your TOEFL. That shows that yes, I'm young. I don't have enough experience, but I do good whatever I do. I'm pretty awesome at doing things. That's what you want to tell them. And on top of that, during your interview, you tell them, yes, I'm a student. I want to learn, but I want to be under your umbrella or under your wings where I can learn it properly. So what they like fresh, the only time I personally have seen young graduates get annoying when they are trying to show off what they are not, and they are trying to say things that they are not aware of. Or they will say, oh, I want to become a doctor, or I want to become an oral surgeon. And they ask them, do you know how long is the training? No. Well, then you're just a naive kid who doesn't know anything, and you should go out and experience life and then come to us. That's the biggest problem. So if you're a I made a video on my YouTube, it would be for fresh grads, is that you want to have the right kind of aptitude in giving your answers. Even, and I know as a young person you have a lot of energy, but you need to be a little bit more articulated when saying things.
All right. So one more question, Doc. What are the
For
suggestions?
the second one, I charge $5, Doc. I'm joking. Go ahead.
So what are the suggestions that you would give for a fresh graduate that doesn't have any experience here in US? Because most of the schools, I think, they require some sort of US clinical experience or letter of recommendations. What is your advice on that?
What did I tell Dr. Laura? You have to make the best out of what you have. If I tell you go and do 6 months, if I tell you you won't get accepted because you don't have American experience, you'll say, screw you, Adriel, I'll get accepted with whatever I have. Right? That's the kind of attitude you want to have. I will still get accepted with whatever I have. So now the point is, we know one thing, you don't have US experience out of the picture. So what we don't have, right? Now the question is, whatever you have, how can you make it sound more interesting? That's an art that you have to learn. You have to figure out what were the good things you did, what were the positive aspects that you did. They asked me in the interview, you don't have clinical dental assisting experience. I was like, yeah, I don't. But the point is, whatever I did in my life, I was one of the toughest or the hardest working person in the room. I went into oral surgery. I did a master's. I worked with a nonprofit. Yeah, I didn't do exactly dental assisting, but whatever I was doing it with a purpose, and I was working hard, and I will come to the dental school with the same aptitude, and eventually you will be proud of the decision you make. Now that's a little bit of over arrogance for other people to say, but I want you to understand that you need to convince them that yes, I did not had the visa, or my parents were not born in US, so I didn't had the opportunity, but wherever I wasn't wasting time. I am a serious person. I get the job done. And if you give me the opportunity to be part of this program, I will make sure you will be proud of me. It's all about aptitude.
Thank you so much, Doc. Appreciate it.
Sure. Dr. Shishmita Shivani.
Yes. Hi, Adriel. Thank
Yes.
you for giving the opportunity. I've spoken to you before, if you remember me, but I'm an endodontist in India and working since 15 years as a professor. But my point here is I don't have any kind of US experience at all. How do I put myself?
I'm the same answer I gave to the other people. Again, you don't have what you don't have, but you have to learn how to make the things sound good what you have. Maybe I don't have the biggest arms, but if my shoulders are big, I need to learn how to use them when I walk around, right? So it's all about once you accepted that I don't have this, but now you need to learn how to present. Even in endodontics, doc, you might be very good at some procedures, but you might not be good at apicoectomies. Or maybe I know surgeons who weren't very good clinically, but they were very good in research. That's how you compensate. So it's all a matter of showing that, yeah, I don't have this, but whatever I have will make me a better dental student as compared to other people. That's that answer which goes through all of these different scenarios.
Well, I have done some dental shadowing just as an observer. Will that take into account if I mention
Everything can be taken in account if you know how to express it right. It is a positive thing. It's about just saying it in the right way. All right, doc. Doc, you there?
Yes, doctor. Thank you.
All right, sure. All right, Doctor. I am gonna say this wrong. Pujita. I'm sorry, doc. You raise your hand.
You pronounced it correct, Doc. Yeah, Pujita.
What? Pujita. Okay.
Yeah. Doc, I just have a question regarding my experience. I finished my dentistry in 2018 and I immediately flew to Canada to pursue my postgrad diploma in health system management and retirement residence management courses in order to gain my permanent residency. And luckily, after these two courses, I got my permanent residency and I had to relocate to United States since I married to a person in United States. Now I started my dental school journey. So I don't have any clinical experience after my graduation, but I still worked in dental offices, but not
So you
directly
work
on
now as a
patient.
dental assistant?
Yeah, now I'm working as a dental
That's good
assistant.
enough. You can mention, you can focus on the assisting experience you got and just try to make the best out of it, because we can't go back in time and change anything. You just, again, you guys are asking the same thing. The principle remains the same thing. What I'm trying to teach you or tell you is that everybody in this room, everybody in the school, everybody who graduated, everybody who's teaching has a weakness. The only thing is you address it in the right way. And if you haven't done anything and you had 8 years of gap, I would have said, doc, you need to do something now professional. But you have done things. So it's kind of like, okay, fine, I wasn't doing this, but these are the other things that I have done, which will make me add diversity to the program and be a good team player. You guys are not going there to teach. You guys are going to go there, do class twos and trophies and some crowns. That's what you're doing.
Okay, thank you, Doc. I just wanted to ask you, how do you want me to tailor this Canadian experience with the dentistry when I'm entering to an interview?
No, that for that I would have to go into your detail and ask, like, you have to. That's a little bit in depth. I like if I was preparing you one-on-one, then I would be able to tell you, like, talk about what are the things you learned dental assisting, and like how did your experience from masters taught you about healthcare insurances. Like, you add that, and then you add, like, during your dental assisting you got to learn digital dentistry, you got to learn how to do crown temps, radiographs, and all of that kind of things.
Okay, thank you, Doc.
Sure. Dr. Sandeep, I know you've been waiting for like 5 years. Sorry, my bad. I have a bias. I'm more inclined towards women. Sorry.
Hello, Dr. Adriel. Thank you so
Yes.
much for this meeting. Yeah, I have a question. Like, after the bench test, do they make their final decision like only based on our that bench test, or do they reconsider all things again, like GPA, TOEFL, and our experiences and our CV,
Okay.
like for final call?
I'm gonna give you two answers. Okay.
Okay.
One answer for everybody. Please, everybody who's listening, I know a lot of people like to ask this. To be honest, I never worked behind the curtains. I don't know what they do. There's
Yeah.
a lot of things that goes around, including see your, what I know, they see your your ethnicity, like your nationality, your ability to pay money, because by the end, if you're a national, if you have international experience, your GPAs, being a male, being a female, being having, they look at a lot of things that I'm not aware of. So after saying that, Now the next
Mm-hmm.
question asks, Doc, you just confused me. Now, should I become a female to get accepted, or what should I do? So no, here's my solution. I'm going to tell you, which I would tell myself too. What you're going to do is whatever is in your control, you're going to make the best out of that and perform your best and enjoy it. And when it comes to the rest of the part, you're going to leave it to God and you're going to meditate and hope for the positive. Why I'm saying this? Because I had a lot of class fellows who did not get accepted, but somebody then left the seats. And at the last minute, they said, well, you want to come, Doc? We will send you an acceptance if you can come and pay money. And they said, yeah, we can come. So with COVID happening, I'm going to say something very weird. You guys won't like me after this, but most probably, I think if COVID didn't happen, I wouldn't have gotten so many acceptances. I personally feel, my friend used to say, cause for you to get accepted, so many people die. They used to crack joke at, but I personally feel when the universe have to deliver you something, it will deliver you. Does
Right.
that make sense?
Yeah, definitely, Doc. Thank you so much, Dr.
Just give me 1 second, guys. 1 second, okay? All right. Okay. All right. Does that make sense to you guys? All right. Dr. Naveed?
Yes, doctor.
Can other people raise down their hands whose answer I've already given, please? Thank you.
Doctor, I had a question. I recently got interview from AGD NYU London program, and I took my interview, and the way you introduce yourself for the question that introduce yourself or tell me about yourself, the same way you explained, I did that. So I'll just briefly tell you about my background. I graduated from India, but originally I'm from Afghanistan. I practiced in Afghanistan for 3 years, and I was a dentist to the president of Afghanistan also. The thing is, right now I work as a dental assistant in 4 different offices, and I work with more than 35 dentists in the US. So when I introduced that and when I explained everything about that, the only thing that came to my mind was that does that affect the thing that I work with many dentists, that I'm all over the place, why I don't work in one place? And that was the question also that the program director asked me.
There's something I'll tell you in life. Like we are immigrants, right? You're coming from Afghanistan, you went to India. Afghanistan is going through its own problem. You go to India, India has its own problem. You come to immigrant in US, there are more problems. You're like, and if you start explaining to everybody, they will get confused, right? They will think this person is a problem, right? So what I tell people, when you're in your interviews, you have to say things in a way that's audible to the American ears. Now, if I tell them that I was doing residency in oral surgery, but in the evening I would go and do fillings, it won't make sense to them. So when you're in an interview, you know this yourself. If you say I worked with 35 doctors in 1 or 3 years or 4 years, they'll say either he has a problem that nobody can stick around with him, or something wrong what's going on. You know this yourself. So when you know this, you should have been you should be careful about it when you're explaining things.
So, doctor, sorry to interrupt you. I mentioned that because I was working through a temp agency. You know, the temp agencies, you work like with, they give you jobs and you work with different dentists. And right now I work like regular part-time with 4 different offices. The reason that I work in different offices because every office has different doctors, different experience.
Here's the thing. Can you make it, why are you making people's life difficult in interview? I'm sorry, I'm not trying to be rude, but just say I'm a temp assistant who got the opportunity to work in different places over the past 4 years. Why do you have to say I worked with 35? It's like, it's like such a weird, like I dated 35 different people. People will say like, what were you, like mad or something wrong in your life? You could just say it took me 4 years to settle down in life and get married, right? I'm saying the same thing, but I'm just making people's life easy. So you don't have to say that I worked with 35 doctors. Why do they need a number? Why are you giving them a number that's going to create confusion? You can just say that I worked as a temp doctor and a lot of temp assistant, and a lot of people do it, where I got the opportunity to work in different places, work as a team player, and learn different aspects in different places. No, you said something which is legal to work temp, and you learn different places. But when you say I worked with 35 doctors, it's just the brain gets triggered. Just like when I can say it took me 10 years, 5 years, 4 years to settle down in my life, right? Or on the other hand, I would say I've dated 35 people. All of a sudden, the wordings, the meanings are same, but you just screwed up the other person's brain. Does that make sense what I'm saying, Doc?
Yes, doctor. Thank you.
So for everybody who's listening to this, kindly you can elaborate the same thing without screwing up the other person's brain. There are always ways to say very negative things in a little bit diplomatic way. His thing is not even negative. His thing is actually more unique, where if I was you, Dr. Naveed, I would say one of my biggest strengths is being flexible in life, being born in a country like Afghanistan and adapting to the situation and the crisis, and then moving to India, learning different languages, learning diversity, learning dentistry. And even now in US, I work as a temp person where I have to work in different offices and adapt to their culture and environment. And that's one of the things that makes me a lifelong learner and adaptable person. So you just used your superpower and made yourself into, like, didn't explain, or in future just explain it better. It's a superpower that you're holding on to, but you're saying it in the wrong way. Does that make sense, Doc? I'm
Yes,
not
doctor.
trying to make it negative. What I'm trying to do is next time you're going to get an opportunity, you make it right. What's done is done. Don't worry about it.
Perfect,
All right?
doctor. Thank you.
Okay.
Thank you so much.
Doctor, let me pick Eliona.
Hi, Dr. Adriel.
Yes, Doc.
How are you?
Good.
I'm Alana, and I have a question. Can you please tell us more about your one-on-one sessions and how many questions can we cover together? And can we ask you questions, for example, after the session is ended? And additionally,
thank you for asking this. So what I do is now, and one of the things I'm going to tell I do one-on-one session. At this time, I charge $600, and what I do is I send you a 3 hours video to watch first. You watch that video, then I read your personal statement, your resume, and then I do a 2 hour mock interview where I listen to your story and I prepare you for possible 95% of any interview questions. I prepare stories out of your life, and it's recorded. So later on, you can go back, write down your answers, and practice them. And I give you feedback on your confidence, if you're speaking too fast, too slow, if you're not making eye contact, all of those kind of feedbacks I try to give you. And even after that, if you have any questions, you can text me on WhatsApp. All right. Now, you're asking how many questions we can cover. What I tell people is that this is very important, guys. I want everybody to understand this. Imagine I had an ortho exam and I took the ortho book and I went to my senior. I said, hey, I got an exam in the next week. How can I pass it? I don't know anything. He said, at this time, I'm going to tell you that 80% of your questions are going to come from the first 3 chapters. Conquer that, learn those, be very good with them, and rest of the 20%, you can later on work on those chapters later. And even if you don't get everything right, you'll still pass with good score. All right. This is called the Pareto's law. If you figure out what is the most important 20% things, it will cover the 80% of your interview. What I do is I focus on that 80% that builds the really good foundation. All right. And I cover the video that I send you covers the ethical scenarios, the conflict-based questions, the questions which can be awkward or different or tricky ones. And the last thing I tell people, you're not supposed to know everything as a student. If you're giving really good answers, they will keep increasing the difficulty level. And at some point, you have to tell them, you're the teacher, I'm the student, I'm not supposed to learn everything. So when people say, I want to know all the answers, I'm tell them you don't need all the answers. What you need is the right attitude. So if you say things the right manner, in the start, you tell me about yourself, your presentation, and they like you. After that, even if you give all the answers wrong, they like you. And if, on the other hand, if you know everything and you're saying everything right, but they don't like you, they'll say this person is not a good student because they think they know everything. Does that make sense what I'm saying, guys?
Yes.
So my main purpose is to give you questions, create stories, but help you create an attitude during the interview so you can present yourself as a good student. Now, this is a very nasty thing I'm going to say, but interviews are a theater. It's acting, guys. Nobody can know actually who you are. Dr. Naveed up here, if somebody's trying to understand his whole life and his journey coming from Afghanistan in 30 minutes, they will get confused and he will confuse them. So do not try to explain. People say, oh, be yourself in an interview. Well, if I be myself in an interview, you guys will run off, right? Because I am a very complicated man. Everybody's complicated. So what I tell people is that you don't have to say everything to them. You have to show them the face of an ideal student version of you so they like you and give you an acceptance. Did I make this system like this? No, it's a rigged system. It's literally an acting. That's why some people get accepted and some people who are very nice human beings, very good dentists, don't get accepted. It's a rigged system. I did not created it. I'm just observing and telling you the truth. Does that make sense?
Yes.
Okay. Now so the way I prepare you in a one-on-one session, I try my best that I cover 98% of any dental school, whether it's Colorado, Boston, Buffalo. What I've learned, their questions will be pretty much the same. And one of the things they will do is they will change the question. They won't say, tell me about a weakness. They might say, tell me one thing that you are trying to change in your life. And you will realize that if you created answer for one question, you can use it to give answer for the next one too. Does that make sense, guys? Guys, are you alive? Okay, all right. You know, it's very weird to keep speaking to yourself on the camera, but because I don't know if I'm boring the hell out of you, if I'm making sense, if I'm going too fast, if somebody vomited or fainted out listening to what I'm saying. It's just difficult up here. So, okay. Now, one other thing, guys, I'll tell you, and you need to understand, I'm one of you guys. I just graduated a little bit earlier, but I'm one of you guys. What has been happening lately is that I haven't told this on the social media or anything, but I'm telling you guys, I'm trying to buy my own practice where I have to deal with freaking lawyers. I have to deal with real estate people, blah, 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 all of those things, go to bank, get loans and all of that stuff. And it's a lot of money you're dealing with and loans and stuff. So that's a part of my life that I'm dealing with. Now, on the other hand, I love doing the work I do, but there are sometimes I posted my WhatsApp number up there online and I get messages and it's a business and people reach out, but I get overwhelmed now. I'm getting to a point where I get a little bit stressed out because my phone is ringing all the time and my personal life, family life gets, but at some point I have to hire somebody, which I don't want to because I like to connect with people. One of you guys, I always hated my supervisor, surgery supervisor, who would make me stand outside 30 minutes just to talk to him. I hated that approach. And I'm trying to figure out how can I stay approachable without mentally busting my brain cells. But one of the requests I'll make some of you guys, if you guys keep, there are especially my Pakistani and Indian friends, please don't keep asking me for discount. If I'm not replying you or if I said no, please understand I am not being rude, but there are certain times if I can offer something free to somebody, I try to, but don't feel you're entitled to ask me again and again. I had somebody who abused me It was a Pakistani person as usual. It's your own people who kick your ass. But by the end of the day, they started being very rude to me because I was not giving them discount. And later on, they got another invite, and then they were again messaging me, and I was like, what the hell? Like, okay, fine, you abused me once, now disappear. They were again asking me for help, and I had to block them. I was like, I asked a couple of my fellowship people that I do, I was like, what should I do? And they said, just block, like you're gonna mentally go ill if you go to. So please be a little bit, sometimes I can be a little bit of a jerk too. If I'm dealing with surgery, I get post-op issues. Sometimes my patients get in issues, I'm dealing with them, and I'm not being patient, but understand I'm one of you, and I hope in future you get in the same problem that I am, that you're so busy and you're so busy making money that you'll understand how life becomes once you're a dentist. But putting that aside, okay, what's the next question, guys? Dr. Mandeep.
Thank you, Dr. Adriel, for the wonderful session. It's been really informative. So my question to you is that you've explained very well the questions, but there is a question that they offer us to ask in the end. So what kind of question should we ask, and
I'm
does
gonna
it
give
hold any
you
value?
the great Dr. Stevenson answer. The renowned Dr. Stevenson, who's a professor emeritus of UCLA, who was a program director, he said, if you don't have a question, don't ask. If they say something to you, genuinely that creates curiosity in your brain about the program, ask. But if you're going to script and say, oh, I read it on Google, I want to ask this question to look smart, please don't do it. Don't do it. If there's something genuinely they said which intrigued you, people start asking questions. What would be the rent of the houses in the area next to the college? Well, the professor doesn't know this. Don't annoy them by asking. Just because you ask a question doesn't mean it will change your admission decision. Be emotionally intelligent. If they like the point is, this thing is like, I don't think even if you need to ask a question. If I was sitting in an interview, I wouldn't ask a question unless I genuinely heard something that create curiosity in my brain. Just because you ask a question and spend extra 5 minutes of their time doesn't make you any smarter. Please understand. I hope more people listen to this, and this problem might get solved, because I get asked multiple times. Okay.
Okay, thank you, doctor.
Sure, Dr. Sabishka. I'm sorry, I'm saying names wrong. I think okay, she raised on her hand. Dr. Savera, if I'm saying it right. Savara? Okay, that went away. Dr. Patel, Madhuri Patel.
Yeah, hello, doc.
Yes, yeah, hi.
So I just want to ask, like, if someone asks, what is the mistake that you did during your dentistry practice? So what should I answer?
What's your answer? What mistake did you do? We would like to know your secret, doc.
Actually, we don't do that much mistakes, but sometimes during denture patients.
Wow. The doc, there might be, as a human being, we make mistake. There will be some wrong impression, wrong crown, wrong prep. There will be something you did as a mistake. That's not
during dentures, yeah. During dentures, the border molding process. Yeah, that time I made mistake, but how to tell them?
So you tell them what the mistake is. You can't say I never made a mistake. Like I'm old now. Like I don't know, but shit goes wrong. Like complications happen. I have nerve issues. I had so many things, bleeding issues happening, and no, I talk to people. They said like it happens to everybody. That's just part of dealing with human body. Whenever you're going into nature, nature slaps you back. So if you just need to sit down and think of a denture is a very safe thing. It's a plastic thing that you did not write, right? Yeah. I would never say in an interview I screwed up a nerve. I would never tell them that. But it happens in surgery. Things happen. But the point is, you need to tell them like some plastic work that you did wasn't right. which is reversible, right? You can always make a new denture, take a new impression, do that. Like, so you have to figure out. I'm not going to give you an answer because there are going to be hundreds of people listening to this video, and then everybody will start saying the same thing, which I don't want.
Okay.
So you need to figure out and always find a problem that's reversible, right? Impressions are always reversible. Denture molding, border molding, find anything that's reversible and say, I made that mistake. Doesn't matter what your mistake is. What matters is what you learned out of it and how you're going to incorporate it to be a better student. That's where the real thing is.
Okay. Got
All right?
it. Thank you.
Sure. Dr. Priyal.
Hello, Doc.
And after that, Dr. Subaski, I'm sorry, I did not getting it.
Dr. Subiksha, sorry, I got disconnected the last time you called.
Okay, after this, you can say it. And I'm not going to say your name, right? I'm so sorry. Just saying sorry. Okay.
You can call me Arani.
But sorry?
You can call me Arani.
That's more difficult than the first one. I'm joking. Aryan, Arani. Okay, all right. Dr. Priyal, yes.
Yes, so Doc, in one of the interview, I was asked that is there something that you want to ignore from your application, and the following question was something that's not in the application, and
okay, I heard a couple of people got this question actually recently. Yeah, you want to hear my answer, or my answer would be I wouldn't ignore. So there is a question they will say, if you have a chance to go back in time, what thing will you do differently? My answer is I wouldn't do anything differently because it makes me what I am. All my failures, all my achievements, whatever it is, it makes me who I am. But obviously, that's an Adriel answer. In your answer, you can tell whatever you want to, like some odd job that you did, some mistake you did, you can mention that. Now, I don't know all your detail, but you can mention some kind of like work you did, some kind of work you not did, something like you have to figure out in depth, like something. Otherwise, my answer would be I would not erase anything. It just makes me in the person who I am. But now 400 people are going to say this thing. So be creative, guys. So if you're watching this, be creative. Please don't say the same thing I just said.
Okay. And Doc, there was another question, like your colleagues and yours religious views doesn't match. So, the answer I told was like, we'll come to I'll try to learn more about their culture, religion, and we'll just come to a common ground. But the face it
Tell them
seemed
war
that
will happen. Tell them war will happen.
But it seemed like the interviewer wasn't satisfied with the
Tell
answer.
them this is how we created Pakistan in the first place. But okay, but the point is, I'm saying this on social. Okay, the fun thing is, well, you say like, yes, there are, as humans, there are always differences. Even within a religion, there are so many differences. You just within one house there are differences. My grandmother didn't agree with my grandfather, but doesn't mean we fight. It's just you learn to disagree as behaved as civilized human beings, and you work along for a positive thing.
Okay.
All right. So tell them something like this. That tell them part of this is what human. There's a very funny. I find him funny. His name is comedian from New York. I forgot the name. He said, when you have billions of people, something will go wrong. Something will screw up. There will be some weird thing that will happen. There will be anomalies in the system. So you don't expect everything to be uniform. And if you're trying to do it like Hitler, you're dumb. So just you learn to understand there will be weird people. When I'm dealing with 100 of people, there will be somebody who will insult me. That's just part of it. I can't believe everybody's going to treat me with respect. It's part of the deal. When I put myself on social media, there's going to be weird shit that's going to come to me. And you just learn to accept it. In the same way, when you're working in different environment, people with different religions and belief and backgrounds, and there will be things that will be awkward, but you just find the best grounds and go towards a positive future.
Okay. And Doc, thank you so much for today's session.
Sure, I'll send you the bill, Doc. I'm sending. Okay, all right. So next question was Doc. Go ahead, Doc.
Yes. So actually, my question was very similar to Priyal. Now that schools are looking for diversity, they always ask this question of you have a culturally different identity, culturally different person. How would you deal with their beliefs, your beliefs? How would you, deal with a culturally diverse class and different beliefs and opinions? So, what kind of tips
That's
would
the
you give
same
us
answer
to
which I did,
answer?
Doc. That you have to learn to agree with, to disagree, and find the best ground for a positive future. That's just part of. You can mention India in itself has so much diversity, so many different cultures and languages. In your school, there were people coming from so many different backgrounds, but eventually you all were colleagues, and you just learn to be positive and create the most optimum future. And there's always, as human beings, there are always some commonalities or positivities that will remain the same, and you just focus on that to create a better future.
Okay. Thank you. I was just going to ask this. I wanted to ask this again because all of them circle back to the same answer. So how can we be creative and how can we think out of the box and answer this question? Because most of us would give the same answer.
You have to know, I gave an answer. 400, 500 people or 1,000 people are going to listen to this. Now you have to be creative and create something of your own. And
okay.
I was going to say
so
Chat GPT, but then everybody's going to start using Chat GPT. Okay.
Yeah, thank you.
So, all right. Dr. Who's next?
Yes, Dr. Swara.
Oh, yes. Yes.
Yes. My question is, I came to United States in 2012 and I finished my boards in 2015. So after that, I started working as a part-time dental assistant from 2015 to 2023. I haven't done any master's or any other education except my BDS back in home.
But you were working as a DA?
Yes, I was working as a DA.
Okay. So what's the question?
So I haven't applied. I applied in 2019. After that, I haven't applied. So now I'm planning to apply. So do I need to improve or do I need to do anything?
Yes, improvement is never ending. You have to do some C courses, preceptorship, hygiene license. You have to. The point is not being the best. The point is showing that you're on a ladder of progression. If you're stagnant, you're not good enough. If you're showing, again, it goes back to the same thing, guys. It's all about your aptitude and showing that I'm somebody who's learning. They don't want anybody who has done it all. They shouldn't. There's nobody who say, I've done masters, I've done hygiene, I've done dental assisting, I've done this, I got good TOEFL. No, doesn't matter. What matters is I've done this, but I'm continuing to invest and learn because I know there's a lot for me to learn. Now, how do you prove it? You do C courses, preceptorship, you do masters, you get hygiene license, whatever you're humanly and financially possible to do for you, go for it.
Okay, doctor. So this cycle I'm applying, do you think my application is standout or do you want me to do anything to improve? Because it's been many years.
I don't want you to do anything. You have to do it for yourself if you want to increase your chances. I can't, I just talked to you 2 minutes ago, so I don't exactly know all the detail, your TOEFL and everything, and I can't go into all the details right now. What I will tell you, wherever you know can be improved, do it. Apply, but work on it. And you know there's 1 or 2 places that needs to be improved. So do it. Whether it's TOEFL, whether it's courses, whether it's preceptorship, whatever it takes, do it. And that will make a difference. One other thing, guys, I'll tell you, I know Colorado does this observership 3 days. There's a preceptorship program. There's one person up here, I think she joined it or not, who's doing preceptorship at Washington. I know a lot of people go to Boston, but Boston preceptorship is expensive and doesn't teaches you much. Like the person I've talked to recently told me, Washington preceptorship, way more hands-on, way better. She's busy, she's doing stuff which is good. The other thing I'll tell you, the reason it's good to do preceptorships or doing observership or shadowing or some kind of like this, I've learned one thing. If you want to buy, like when I was when I came to US, I was doing a master's. I was broke as hell, F1 student visa. Most of you can understand, like living on pennies. I would go to really expensive stores like Rolf and Lauren and these kind of places, and I would just look at those clothes and imagine how would I look in them. Sounds silly, right? But the point is, you want to do this, whatever you want in life, whether it's dental school, whether it's having a clinic, whether it's having $1 billion house, or whatever you want to go and see and actually imagine. Once you start imagining, you will eventually become the person to be in that cloth, be in that house. Reason I'm saying, I took a recent, because I told you guys I'm trying to get my practice. I went for a consultancy course to somebody and they told me about how many $1 million of practice they sold at the age of 45. And I actually paused for a minute, that I never even thought that at this age a dentist can earn so much money. And I realized, because I never even imagined, I could have never even done it. And the reason I'm saying this to you guys, even though it's not regarding Caapid, but as a dentist, if you see, if Adriel can do this being one of us, and you saw it, you can imagine you doing it better than I did. All right. And if you start imagining, you will become that person. And this is very important thing. I would tell, like, now I understand, if you have kids, take them and make them shadow big people. Like, if I get a chance, I would send my kid to Elon Musk, like, go and see one day. Because if you can't even imagine what a big personality looks like, or being in that, if you can't imagine, you will never become that. And I'm not saying Elon might be the best human being on the earth, but I'm just saying, like that, you want to put yourself in environment and places where you can actually imagine. So that's why when you go for preceptorship, yeah, you learn things and stuff, but you want to actually imagine, if I was a student, how would I look? How would I do things?
Okay.
Does that make sense, guys?
Yes, Doc.
Okay, I hope I'm not throwing a lot of information at you guys, but do write these points down. I wish somebody had told me these things back in 2018 and 19. All right. Okay. Dr. Laura, and after that, Dr. Tammy. Interview question, guys.
Yeah, doctor, I have yet another question. It's more related about the CV. I don't know if it's a good idea to put a TOEFL score there in the first
You
place.
should. If you have good scores, sure, brag about it.
Okay. Is there a special place in the CV where you should put it? Or just...
I usually put it on the top part. I put my BDS, MHA, and then my TOEFL and INBD, because these are the things they are looking for, right? Make their life easy and show them what they are looking for.
Okay. And what about for example, my thesis for my master's in Spain, or is it irrelevant for them?
You can put it down in the research and publication or thesis, but that's not their main thing they are looking for.
I thought so. Okay, thank you.
Sure. All right. Dr. Tammy.
Hi, Dr. Adriel. So I'm going to take us back to the square one. When we were talking about don't talk anything negative in your interviews, I was actually talking in a sense of personal life. So if I give you a perspective, I'm from Pakistan and I am one of the minorities, and I grew up in a very rural area where like girls going to the schools is a very rare thing. Like even if I talk about like the generation before me, like all the women, none of them went to the school. But this is a thing that I
You
don't
were
want to
in
show them,
Sindh?
okay, look
Were
at
you
me.
in Sindh, or where? Where was this?
It was in Sindh, yeah. It was in Sindh, and it was in a very small village, yeah. So I don't want to show them that, look at me, I'm a bichari. It's just I want to show them how far I came, like how far I came and how far my family came. So
You
from
can
my whole
send them
thing, if
a
you
you can send them a Google Map trail. How far you? Okay. All right. Let me help you out with that. Okay. Really quick. All right. Good question. I had people who are Ukrainian, who are going through wars and all of stuff. People coming from Middle East. I can understand your perspective coming as a religious minority. Grew up as a Christian in Pakistan, even though one of the things I'll tell you is, like, fine if you had something different or something difficult, you can mention that. If I was answering you really quick, I would say I was in a I grew up in an environment where I was, as a religious minority, I grew up in a very rural town, and amongst that, I was a female. So you were a minority within minority. But I was fortunate that I had a family which really devoted their resources towards education, who wanted their girls to get professional education. And I think that was a building foundation in my life. My father, my mother, my whatever supported me to go for professional education. And I think till date, it really gives me the support to pursue advanced education in the US. And somebody just left after this.
Okay. Yeah, like makes sense.
Okay. All right. Sounds good. Okay. All right. I'm gonna take a few seconds of break. I want to grab water, and if you guys have any questions, we can touch on them. All right. Sounds good, guys.
निदा के मसला क्या बोल रहे हो उसका वो भेज रही होगी वो 6593 अब बात में देखता हूँ क्यों मैं को नहीं दिखाना चाहता तुम देख लो मैं तो इसलिए नहीं देख रहा था कि मीटिंग जाएगी उसके उसने वो भेजे होंगे मेल आईडी उनकी बिल्लियों की फोटो भेज रही है आई ओनली सी डॉक्टर एबोलिस इन दिस वन ओके इस पे भी था डॉक्टर शिवानी को भी तो भेज सकता हूँ ये भी तो मेरे ग्रुप लीडर थी sorry for replying sorry actually we have Eid today so it's been a little busy my brother flew in from
Hi,
Ohio
Sandeep.
who said hi to me
Hi, Sandeep. I think your audio is on.
okay. Let me
All right, guys. What other questions you have? All right. Any other questions?
Doc, quick question. Let's say in Akira, some weird question appears, and we have, I believe, 45 seconds to prepare, and we don't know the answer until that 45 second is gone. We could not think something concrete. Like how in that anxious situation, how do we perform? Or what should we do?
It's gonna happen. I'm just letting you know. This will be. I can tell you right now. I have recorded videos. People who are preparing for San Antonio, NYU. I have paid, recorded, and like Kira talent assessment videos. Some people bought it, prepared it, and they are still asking, "What if weird question?" So usually they ask. I'm just giving you a heads up. In Kiras, they love to ask about your strength, weakness, leadership role, critical thinking. If somebody's fighting in a group, somebody's not doing their work, what's your leadership model? And I've gathered these questions from sitting in different Kiras and gathering questions. They can ask you about, tell me about yourself, your long-term plan, these kind of things. But obviously, there could be a curveball. There can be something which you might not know, like legacy, what's your philosophy of dentistry, these kind of things, right? The solution is, what if do you drive, Doc? Do you drive?
Yes.
Okay.
Yes.
What if I tell you you're going to go 5 miles, there's going to be a stop, you turn right and you go to the Walmart or whatever. But all of a sudden you're going and a rock or a tree fell right in front of you. You're going to hit brake, right? Or you're going to take a different turn, right?
Mm-hmm.
But you know how you did that? If your brain is actively in a relaxed stage, if you have some really serious family problem going on and in stress, you're going to most probably hit that tree. So if there's always, life is going to throw a curveball at you. There might be something different that's going to come in there. One thing, your human brain is a descendant of the humans that has survived for thousands of years, and it can manage a difficult question. It can be creative, it can create some kind of solution, it can. The only way to do it, when you're in a state of creativity, when you're in a state of not being anxious. My problem right now with a lot of candidate is that i get I get a little bit agitated myself. That triggers me as well. 95% of the candidates, there are very few, and I respect them a lot, who are calm and placed in their situation. Most people are coming from a state of starvation. They are stressed. And I'm not saying physically, like from the stomach starvation, from mentally, they are always in a state of starvation, like they are trying to be very desperate, trying to grab things like they are dying. And the first thing I have to I do fellowship program, like where I have like a inner circle kind of a group, where I have about 15 people right now, which I work with them throughout the Caapid. I try to do a weekly calls with them. If they have issues, I try to talk to them on text or phone, whatever I can. I try my best to work with them. But one of the things I try to do is that you can't create anything positive for yourself if you're always in a state of desperation. People who get accepted are not the luckiest, are not the one geniuses, are not great. They will act like, oh, I got accepted and I know everything. Bullshit. They don't know everything. Even I don't know everything. The point is, people who get accepted are the people who are in a state of a little bit more positivity. You need to tell yourself before interview, take a paper and pen and tell yourself, you are capable of a lot of things, and whatever difficult thing will come, you'll find a solution to it. You'll find an answer for it. I Trust me, when I open up a human's mouth and do a procedure, there will be a curved ball at me. There will be some bone that's going to act differently. There will be a root tip, or there will be a sinus exposure. Things go south all the time. The point is, you have an internal confidence. Whatever it takes, things will work out for me, because that's how my destiny wants me. Okay. And I can't prepare you for everything. Your parents can't, your teachers can't, your coaches can't prepare you for everything. That's why the best coaches are the one who give you a confidence and an attitude that you can get the job done. All right. Does that make sense?
Yes, thank you, Doc.
All right. All right. Okay. So yeah, long. I made the whole thing long, but the short answer is there will be something off the ground, some dodgeball. It's not about knowing everything. It's about having that goddamn attitude that I'm gonna make it work. That's the biggest thing. People who are winner, they have an attitude. I will get the job done. That's it. I will make it, whatever it takes. And the problem with most female is they can't. Oh, with male too, but because in cultures we were never told that you can do it. You're told, oh, you're a woman, you can't do it, and you have limitations, and you always come from a sense of insecurity. I can say it because I grew up as a minority. There are certain things attached to me which were told to me. All right, you can't do this because you're like this or that or blah 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 or all of that. You're not the richest, not the smart. But screw you, destiny is way bigger than that. If God is supposed to give me, he will make me get things during COVID. That's how most of my life been. So, and it's not, you need to have that attitude. Yes, Dr. Harsimran Kaur. Hello.
Hi, doctor. So I just had one question. Actually, when I did my degree was like almost 10 years ago, and then I practiced for 2 years. Then I went into a different stream as a pharmaceutical. I worked there as a global trainer and everything, but I was still practicing dentistry. So do I just mention my dental experience, or would that give me brownie points?
Focus more on dental. Where are you living right now?
I'm in Canada at the moment.
God, there's another Dr. Harsimran Kaur that I knew. Okay, I thought you're that person. Okay, but okay. So the thing with that is you want to focus more on clinical work, and on top of that, you can mention that you got an opportunity to work part time like this. But and in the comments, don't don't tell people to mute them. I'll mute them. Don't worry about it, guys. It's be easy. Okay. So the point is, you can say in part time you got the opportunity to work in something else, like you can mention that I got opportunity to work as a sales trainer or biotechnology firm that taught me this and this, but focus more on clinical things. Guy, whoever's listening to this, remember, if you work as an office manager or regional manager, your chances of getting accepted is comparatively less as compared to somebody who works as a dental assistant. They prefer clinical experience over managerial experience, just to let you guys know. Both can get accepted, but I'm just saying clinical experience is better. And then on top of it, you can say part time or once in a while you did it.
Okay.
All right.
So I should not I am actually focusing more on the dental in my whole application, but I've mentioned that I have another experience on top of that. So I just wanted to know if that's
Yes,
fine.
okay. You can. It's just about how you use your words.
Okay.
All right.
All right.
Okay.
Thank you.
Sure. Dr. Pratap, Shruti Pratap.
Hello, Dr. Adriel. Thank you for doing this. My name is Shruti. I have a question that is a little off topic, probably for today's session. It's about Kira talent. Does it work on an iPad Pro? Is there somebody among the participants who had taken it from an iPad Pro?
I think they can. I'm not sure. I wouldn't have the, and I don't want to screw you up. Like I'd say, yeah, you can do it from your phone, and then you can't, and then everything goes wrong, and you're swearing at me for giving you a wrong advice. So one other thing I'll tell you guys, I I think it might work, but I'm not sure. So there's the answer for your question. The other thing,
Okay, I just tried to log in from the iPad Pro, but it's showing that my browser is unsupported.
Doc, here's the thing. If it's NYU, if it's whatever school it is, they have IT sites. I'm not the IT person. I'm not their tech support. You need to message them and ask them because I can't give you an advice that I don't even know.
Right.
So I can get you in trouble. I'm not trying to run away from helping you, but just because I sit on the YouTube with a suit doesn't mean I would have all the answers, right? So I don't want to tell you wrong. They have, these places have designated IT people. Email them, ask them. You don't want to risk. You don't risk.
Okay.
Okay.
Thank you. Thank you.
Good. The other thing I'll tell you guys, like, I wanted to tell you, first of all, to all the candidates, whether you're in India, Canada, Cuba, Venezuela, or other part of the world, Pakistan, please understand the American timing systems. I write a time is EST, PST, whatever it is. You need to learn there are different time zones and what they are, because I know most of you guys do, but the schools are not going to tell you what is EST, what is New York time, what is California time. They're just going to write PST. You have to figure it out. Go Google it. Do not like come back and say, what does EST or PST, or like learn these things. This is very important. I know in most countries there's the same time, but you need to know these things. And being tech savvy is important. You need to learn technology. That's very, 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 very important. All right. I'm not the best at it. I don't teach people computer or Microsoft Word. I'm not the best. I hate doing it. I just do it enough to get my things working. But you need to be tech savvy. That's important to be successful in the dental realm. All right. Dr. Sonam, yes.
Hi, doctor. I have been doing dental assistant here for almost 3 years, but unlicensed. So do you
What do you
think?
mean unlicensed?
So not licensed as a
Where?
dental assistant.
Which state?
Minnesota.
Do you need a license to work as a dental assistant there?
It depends on the clinic, I think. So
In
the
Ohio,
dentist.
you can, if the doctor lets you, you can even without the license.
So for the application and for the CV, do I have to mention
just mention you work as a dental assistant.
For the CV, right?
Yeah, for your application, right? You work as a dental assistant.
So do they ask questions like, oh, you're not licensed when they ask question, like
I
you're
don't know, Doc, about your state. Again, California requires license, Canada will require license, New York and Ohio won't. So I don't even know this. Your state legally requires you to have a license to work as a DA, or you can. If you legally can, then do it.
okay, but because the thing is that I've been working under her and she's okay without license, and I
Again,
think
Doc, you're not
sorry.
understanding that you need to also be aware. In Ohio,
Okay.
you need to have license, but if the doctor is fine with you, it's legal according to Ohio state boards. I don't
Okay.
know what Minnesota Ohio board says, so you Google it.
Okay.
And if it's legal, then do it.
Okay.
Okay.
Okay. And for the CV, so I have been doing unlicensed. So should I mention unlicensed dental
Doc, you're
assistant?
not understanding the thing. You're focusing on license, unlicensed. Nobody care about license or unlicensed. All you need to make sure, if it's legal, nobody cares about mentioning license or unlicensed.
Okay. Got it. Got
So
it.
the word license, unlicensed doesn't matter. As long as you're legally allowed to work as a dental assistant with whatever qualification you has, mention it. Don't
Okay.
license, unlicensed.
Okay.
Most
Okay.
of the people who work as a dental assistant in US don't have license, like foreign trained dentists.
Oh yeah, yeah, yeah. Okay.
Only California creates problem and some other places, but most of them don't. So
Okay.
as long as you legally can work with the, if the dentist allows you, mention it.
Okay. Then okay. Thank you so much. Thank you.
Sure thing, Doc. All right, guys. Any other questions regarding interview? Okay. All right. So all right, guys. So these were most of the things that I wanted to point out. I know there's far more things I can go in depth and we can keep speaking. There are a lot of ethical scenarios on my page, YouTube page. You can watch them. That gives you a basic understanding. On top of that, remember, presentation matters, how you connect with people, your articulation of words. These kind of things matters the most in your interviews. Your attitude matters more than your knowledge. The school is looking for the right attitude, not for the person who have all the answers. The other thing is, if you need one-on-one help, I'm a little bit pricey, expensive at this point of life because I have too many things going on in my life, so I have to price myself a certain way. It's not that I'm trying to create a mention out of the money I'm getting from foreign trained dentists. I can understand it's difficult. I've been one of you. That's why I have recorded sessions too, which is a little bit less expensive if you want access to those. The recorded sessions are more in depth as compared to YouTube videos. YouTube videos are more generic. And other thing I'll tell you guys, I'm gonna try to do every month a free session. You can join it. I'll post it on my Instagram again, whatever would be the next thing. And I wish you all the best and best of luck, guys. All right. Thank you. Take care.
Thank you, Doc.
Thank you. Take care.
Thank you, Doctor.
I'll post this.
Thank you, Doc.
You're welcome. I'll post this soon. All right.
Thank you, Doc.
Take care. Bye.